Hey, everybody, welcome to a special edition of Slice of Piefer. This morning, I am on Breakfast with Champions, the Business Friday. I get to be the keynote speaker talking about high stakes leadership, high stakes, high pressure, and high trust. I am super excited to be here, and we're going to get things started. Between the operating room where I spend most of my time and between the boardroom and the office where business leaders are leading in these same high stakes, high pressure situations. Really, I'm going to talk a little bit about some of the pitfalls, some of the things when the pressure gets too high, some of those diagnostic issues that happen where people lose that focus a bit. Not only lose the focus, but they have tendencies to trend in different directions. And see if as you reflect a little bit, see if any of these different types, whether it's the leader who functions as a tyrant, the leader who is a pleaser, the leader who is indecisive, or the leader who is maybe unprepared, or the leader who gets flustered or who gets distracted when that pressure rises. Do any of these things happen for you, or do they happen for the leaders that you work with? Because a lot of folks work with leaders who are in this same scenario. And then finally, we'll talk about the foundations of exceptional leadership and what I see as a leader in the operating room. That number one, if you will the good of the people you work with, if you will the good of your clients, will the good of your patients, and will the good of your team, essentially loving those people is going to make a huge difference, and it's going to change the world, and it's going to change your outcomes. You've got to approach life and leadership with humility, with gratitude. You've got to have skill, and you've got to be confident. So like Nick said, I'm an orthopedic surgeon for the last 14 years. I'm board certified. I am sports medicine fellowship trained. I served on medical executive committees, governing boards, chief of staff, and chairman of the orthopedic department at Level 2 Trauma Center here just north of Houston, Texas. I do practice orthopedics full time. I've probably see, I would say on average about 5,000 patients between myself and my team, 5,000 clinic visits, I should say, per year, and do over 600 operative procedures per year. So we keep quite busy, but when you're that busy, the pressure can be high, and it's important to maintain those things. When we talk about high stakes, it doesn't get much higher than dealing with lives, with limbs, and with livelihoods. And that is where I live most of my days, at least a couple of days a week. We're in the operating room, and then every day we are working and serving patients, trying to improve their lives, trying to improve their livelihoods, and trying to improve their function. The pressure is the challenge, right? As pressure increases, how leaders respond is super important, and that pressure can cause folks to not only lose their focus, but also to crack a little bit under that pressure, and to try to have a little bit of a defense mechanism to try to get things going. Finally, high trust, right? If you imagine in business having 40 meetings in a day and having to make decisions in those meetings that are changing people's lives, each of those meetings may be between 5 and 15 minutes, establishing trust to now have a patient trust you, or a client to trust you to change their life for good, right? To change their life for the better and to get them where they need to be. All of those things as a leader, if you lose that focus and if you lose that foundation, we can see these high-level problems that can come. The first of those challenges that I see tends to be the tyrant. And right, as a medical leader, we have to deal with behavior issues in the OR. As many people may say, hey, it's hard to believe that doctors or surgeons may not have that same level of kindness that we see all the time, especially when they're behind closed doors. And we see that, and as that pressure mounts, we'll see that even the tyrant, right? That tyrant or the dictator who comes in, the power's gotten so much to them that they now treat their team and they treat their the entire support staff essentially as tools, right? And you can't treat people as tools and expect them to perform for you ultimately as we keep moving forward. That piece, those folks tend to make excuses for behavior, things like results first, safety first, the patient comes first, but they do that at the expense of their team, and their team tends to back away. The team, when they need them to move forward and they need them to move into the process, they back away from the team because they're trying to avoid the pain of having to deal with the tyrant or the dictator. So it's not uncommon in the operating room for surgeons who lose their cool to send nurses home crying, right? And that's just not appropriate. that's not going to functionally get you where you need to be. And ultimately, it's going to be a patient safety issue. It's going to cause problems in your business or in your surgery. But you can imagine if your team behind you is constantly living in fear, if they're constantly living to try to avoid the pain that you're causing as a leader, even if you're just raising your voice, if you're using profanity, if you're not treating them with dignity and respect, then ultimately that will compromise your outcomes. It will compromise safety, and it will compromise your ability to get the things you need done. If you're working under a leader like that, then it becomes very important that you recognize that you advocate for yourself, advocate for your patient, advocate for your client, so that you can move forward and you can have the folks who have the responsibility and who have the power to help take care of those things, which may be the upper level leadership, so that they can see where they need to be. What we also find is you'll find kind of almost the opposite of that, which is the pleaser, right? This is the person who's got the weak pulse. This is the person who avoids confrontation. When the pressure gets up really high, they tend to back away when they could offer constructive criticism, when they could offer things, offer support for their team that's going to make things better for your clients and for your patients. They tend to back away. And so as you reflect and look at what you do I avoid that confrontation in order to try to avoid increasing the pressure on my own? Now, sometimes increasing pressure a little bit by offering constructive criticism, by saying, how could we do things better? By taking a time out and debriefing at the end of a case allows you to really focus and refocus your team. But that pleaser will avoid that situation as they keep moving forward. Now, the big challenge that we sometimes see, especially with young surgeons, is the indecisive person. This is that analysis this is paralysis by analysis, right? Or the analytic paralytic, right? They keep analyzing and they keep getting data and they keep gathering more and more data. And that gathering actually becomes a defense mechanism. It prevents them from finally making the decisions that they need to make. And it allows an outlet for the person who's indecisive to continue to delay their final choice. And ultimately in surgery, we say all the time, you've got to make the cut. You actually have to start. If you don't start, you're never going to get anywhere. You're never going to get to do the service you need to do. You have to make the cut, and the indecisive will gather data in order to avoid that. I think it's super important that if you're in a phase of analysis, you have to set those boundaries and you have to set the ability to move forward so that you can make a decision and you can help treat your team, treat your patient, and treat your clients. Now, occasionally, and this happens even in the operating room, you see the unprepared, right? This is the person who's a relier, and these folks, it's hard as it is to believe, they may be trying something new, they may be doing something new, and they look to their team. They rely on their team, but they also blame their team sometimes for not providing them the support that they need, when realistically the ownership should be on the leader. The leader should be the one who is leading, and the support team should be supporting. Again, you want people moving forward and moving in to help you, not moving away. This unprepared or incompetent relier tends to be the one who blames the equipment rep or the medical team, the scrub nurse or the scrub tech, for not providing something that they needed. Or they tend to look and they say, hey, what's the next step? Because they don't know that. And then ultimately you find out that they need 10, 15, 20 steps of guidance. And so that's where really trying to focus on ultimately being prepared so that when the pressure situation comes, you can attack it the way that you need to as a leader. Ultimately, surgeons and leaders can get flustered, and that flustered person ultimately results in systemic failure. And that flustered person is the one who's lost control. They tend to elevate the temperature in the room. They tend to elevate their voice. They tend to move. They tend to lose track and lose their ability to tell people what they need to do. So when you get flustered like that, the team starts to break down because they see that you've lost your confidence. They see that they've lost what's happening. And once the leader loses confidence, the team falls apart. And when the team falls apart, the outcomes become difficult. So if you're a team member and you have a flustered leader, it's important to try to lead from behind. It's to try to lead and be the anchor. And if you feel yourself as a leader getting flustered, it's important to step back. It's important to take a breath. It's important to realize that in this case, pushing and pushing and pushing is not getting you where you need to be. And you need to take that breath and understand that we've got to get that flustered feeling taken care of. Finally is the distracted and do it all. This is the micromanager, right? This is the person who allows everything to become the most important thing, whether that's a text message, whether that's a consult, whether that's this small part of the business. These distracted do-it-alls, they tend to micromanage and they're unable to delegate. And that piece is very, very challenging, especially as you continue to move up the ranks of high-level leadership. The highest levels of leadership, you've got to find the things that can be delegated to the people who do them well and to the people who enjoy doing them and who even do them better than you do. I think that is such a key as you keep moving, and it is such a temptation in the world that we live in today to get distracted, right? I think that it's so important to be strong, but also to try to maintain that I'm going to stay focused and I'm going to find the things that I do best, that I enjoy the most, and I'm going to find people who can support me where we need to be as we keep moving forward in those scenarios. So those are kind of the six big leadership flaws or leadership diagnostics that I see when I've had to deal with physicians who are struggling, right? The tyrant, the pleaser, the indecisive, the unprepared, the flustered, and the distracted. Those six, any of those will ultimately result in lower productivity, lower ability, and lower ability to really mobilize your team. Imagine as a business person, if you're sitting in a room, because when I go into the operating room, essentially no one in that operating room is my employee, right? Between 7 a.m. and 5 p.m. as we do surgeries, whether we do one surgery or we do 10 surgeries, every person in the room gets paid exactly the same, right? And so how do you motivate people to do as much good as we can possibly do if their reimbursement is exactly the same, right? It's just human nature that they may back away. They may move a little bit slower. When you make their life more painful, it makes it more difficult. And that's where I say that you've got to convert the pressure into purpose. And if you can help your team to understand that the purpose of what we're doing is willing the good of our patients, if you can convince your team that the purpose of what you're doing is willing the good of your client and it's willing the good of your team, well, that changes the whole entire focus of your team, and people will move faster, people will engage more, and people will be a part of the team and help support you the way that they need to. I think that it's so important because you cannot unite a team around fear. You cannot unite a team around money. You cannot unite a team around any of these different challenges, these leadership motivational strategies. The purpose has to be willing the good of your team and willing the good of your patients. And that part, I think, is so important for leaders to understand. And it's so difficult because we can lose sight of it as we gain power, right? As surgeons, right? Imagine for yourself, you've been to college, you've been to medical school for 4 years, you've done 5 years of residency, you've done another year of fellowship, and now all of a sudden you're out and you're on your own and the pressure is on. But you went from the person who the nurses kind of looked at and said, well, this guy's a medical student or this gal is a medical student, to now, doc, what's the order? What do you want us to do, right? All of a sudden you have a degree, you have power. That I can see that happening in business as you move up in the world. And now everyone looks to you and says, hey, what's the plan? The pressure is on you. I mean, I'll give you an example of one thing that's an emergency in orthopedic surgery. It's called compartment syndrome. All right, compartment syndrome. If you've never heard of it, not important for that because I'll explain it. But if you imagine, if you feel on your forearm or if you feel on your lower leg below the knee, there are compartments, and inside of those compartments are muscles. There are blood vessels. There are nerves that are inside those compartments, and you can imagine that in a business you've got compartments. You have different areas. Well, if you have a fracture, if you have an injury, and you start having bleeding inside of a compartment, you increase the pressure. And as that pressure increases, it squeezes everything. It squeezes the muscles. It squeezes the nerves. It squeezes the blood vessels. And ultimately, it cuts off the lifeline to that compartment. And then it'll ultimately cut off the lifeline to the limb. As a surgeon, you have to have that ability to not only diagnose that, but you've got to release the pressure. And that's what we do. We have to go and release that pressure. And that is a high pressure situation. For example, we'll change a few of the details, but I've got a patient, or you've got a patient now who has shown up to the emergency room, right? They've already been to an urgent care. They had dropped a weight on their leg while they were at the gym. It was a 20-pound weight, so not a super heavy weight. They got an x-ray at the urgent care. The urgent care said, hey, you don't have a fracture. You're going to be fine. Use some crutches. They go home, and over the course of the next 3-4 hours, they get worse and worse pain. The pain just keeps increasing. That pressure inside the leg keeps increasing. We get the phone call. I get the phone call, now 12 hours into my day, that says, hey, we've got somebody and we think they might have compartment syndrome. Now, this is a call that we get all the time. 9 times out of 10, they don't have compartment syndrome. And especially with that story, very unlikely to have a compartment syndrome. We say, well, if it's compartment syndrome, let's bring it in. Let's get them here. We're going to take care of this emergency and we're going to move forward from there. And we go look, and now I'm standing in the emergency room. I have 15 people standing around me looking at me, and I know that the next decision that I make is going to be life or limb for this patient, because if I choose to watch this for the next 2 or 3 hours, this person could lose function. They could lose their livelihood. They could lose the inability to feed their family. But if I choose to move forward, to open up these compartments, to relieve the pressure in that forearm or in that lower leg, well, now I've made a decision that could change this person's life in the other direction. And if I made the wrong decision, that is a high level of pressure. But ultimately, you've got to make the decision, and you've got to understand that now, from that moment that I move forward and say, we're relieving this pressure, there's 30 other people who each have 25 different touches on this patient and 25 different times that they've prepped and draped and done things to get me to where we need to be so that we can help that person to move forward and to enjoy, not only a great life, but a great livelihood as they keep moving forward. And the consequences can be dire. In this particular situation, this person absolutely had compartment syndrome. We absolutely needed to relieve the pressure. When we opened up that compartment, you could see that muscle was just not alive. It was struggling. And as soon as we opened it up, the blood flow returned and everything got better. Ultimately, multiple surgeries, skin grafts, those things had to happen. Like I said, we have to make difficult decisions and challenging decisions. But once we opened up that compartment, we relieved the pressure and we moved forward. And so in businesses, you don't want to have a compartment that the pressure is getting so high that as a leader, you're leaving those folks to really cost you the limb or to cost the livelihood of your business, right? You've got to relieve that pressure. And you've got to make the diagnosis, and that's a difficult decision, whether that's changing your team, whether that's changing the team that's in that compartment, whether that's changing the foundation of how they work. You have to make that decision as the leader, and I think that's super, super important. I want to talk about, we've talked about sort of the diagnostics of and pathologies of leadership, but the foundations of exceptional leadership, in my experience, are fivefold. Number one, you have to will the good. And I keep saying will the good. Willing the good of people is essentially the definition of loving people. And it's not common that you hear leaders, that you hear entrepreneurs, or that you hear surgeons talk about love, but the definition of love is to will the good, and willing something is an active behavior. You have to act. You can't think about it or want it or just hope that things are going to happen. It requires action, and it requires you focusing and making an effort to move forward for your patients, for your clients, and for your team. When you found your business and you found your life on willing the good of the people around you, your team will mobilize with that purpose and they will move forward. Number two, you've got to be humble, right? Humility is super important, right? The tyrant has lost it, right? They've lost that ability to understand. And it's that temptation as a surgeon or that temptation as a leader to say, it's all on me. I'm the one. I'm the one who got this patient better. I'm the one who did this. When the reality is, like I said, there's so many touches. There are so many people who make my life and my ability to perform so important, whether it's nursing staff, scrub techs, anesthesiologists, anesthesia assistants, the folks who are in sterile processing, the folks who are cleaning the operating rooms before I get there. I'm not doing any of those things, right? And it's super tempting to pull in and to say to yourself, hey, I'm the important one here, right? I'm the one who makes the decisions. I'm the one. But if you can turn and recognize your team with true and honest and open gratitude for the team, you will make a huge difference in uniting people around you, because they know that you appreciate what they're doing. They know that you know that without them, things change. Imagine if you had to do a 200 step process, which sometimes we have to do in the operating room, and that gets delayed by 10 seconds for each step that you do. Well, all of a sudden now you lose your ability to perform. You lose your ability to produce because each surgery takes longer and longer and longer, because your team is not mobilized there behind you, and they're working to move slower instead of moving quicker, right? Instead of moving more efficiently to try to perform at that super high level. Along with humility comes gratitude, right? I think it is so important, so important to thank the people that you're with, to be grateful for what you have. I live in a world where I am just abundantly blessed. And most business leaders and entrepreneurs are there too. And to take a few moments to think about that and to think about, man, I really have an opportunity I get an opportunity to change people's lives, and to just thank those people that work so hard for you, that work so hard with you. Those folks are amazing. I mean, I think that it's super important to be grateful for those things and to understand that not everybody has the opportunities that you have. And that's where the pressure can kind of change that, right? Your perspective changes as you look. If you believe that, right, whatever, it's the end of a 14-hour day, I'm exhausted, I've done 7 surgeries, I've been on call, right? Not everybody gets to do that. Not everybody gets to have that ability. Not everybody gets to run a business. Not everybody gets to change the process or change the projection and change the trajectory of their business for the good, right? And to help not only support your employees, but support their families and support their clients, right? People, that pressure changes with your perspective. And if that perspective is one of gratitude, then I think that you're going to, I think that perspective, when it changes to one of gratitude, it will change your ability. It'll change your perspective when that pressure mounts and when that pressure rises, how you approach everything that you do. You've got to have skill, right? We don't want to go see a surgeon or go have a leader who doesn't know what they're doing. And that's why I think it's super important to understand, right, the level of training and the level of skill and the level of improvement and the level of constant improvement that happens over the course of a career, right? Continuing to get better, continuing at the end of any of those 500 cases that happened this year to do a debriefing, to look back and say, what could we have done better? How could we have made this more efficient? How could we have made this easier on the patient with less anesthesia time, with less bleeding, with less other challenges? And I think if you become complacent, then you lose that. And once you lose the ability to keep moving forward and continue to develop your skill, then the challenges really mount in those scenarios. I think finally, when it comes to skill, and one of the things that I hear a lot of, especially I have teenagers, I have a 17-year-old, a 15-year-old, and a 13-year-old, right? And everybody in this age group and in the college age group and in their 20s, they want to become a CEO. They want to become super successful. They want to become successful very early, very quickly. And they see this super tiny percentage of people who are able to do that, or who are maybe the outliers. The average age of a CEO in the United States of America is like mid-50s, 55, 54, right? And so if you told a 22-year-old you're going to have to wait 32 years to get what you think that you want right now, right? That same 22-year-old might say, you know what, I don't want to go to medical school because it's too much school. Well, it's too long. It's too much training, right? 4 years of medical school, 5 years of residency, 1 year of fellowship. Well, actually, if you look back, if I had thought of it back then, I was a CEO at 32, right? When I finally got out and got a real job as an orthopedic surgeon. That's a little bit of a different perspective. It's a different way to look at things. And if you're doing great in your 40s or you're doing great in your 60s, like, just keep pushing, but keep developing your skill. And finally, I think that you've got to be confident. That confidence is super important. It's super important in the OR. It is contagious to the people who are around you, and it is much different than arrogance, right? Confidence and arrogance are not the same thing. If you are confident in what you do, if you know what you're doing and you're confident in your team, you will inspire your team to work so hard and to work so well to provide great outcomes. That's why it's important to come back to your team. And, you know, for me, the team who helps me reconstruct an ACL in the operating room, none of them really get to see that patient at month 3, month 6, month 9, at 12 months, unless they're a collegiate athlete or somebody they're going to see on TV. They're not going to get to see those folks go back and play and elevate their level. But to go and share that back with your team is important. Those things are important to share because I think those pieces are such an integral part of building your team and going back, not only to be confident that you can do it, that you can get people where they need to be, because you'll inspire confidence not only in your clients, you'll inspire confidence in your patients, you'll inspire confidence in your team, and you'll inspire confidence in yourself. And you'll avoid those scenarios where you're having challenges. And not everybody is a tyrant, right? But there may be some times where you feel that pull, man, if I could just, or where you get flustered and you lose that control. And losing that control ultimately is not going to get things moving. It may move things more quickly in the short run. It may move things more quickly in that operating room. But when your team refuses to work for you because you make their life miserable, you're going to lose that ability to will the good and to love patients and to love people so that you can move forward. I think that overall, there are so many parallels between the operating room and between the boardroom that people just don't really get to see. People don't know. And it's a wild scenario that we live in where people trust surgeons based on what they see online. They hear some, oftentimes you'll hear people who who know somebody who did great. And right, that's great. Those referrals, that not the self-referral, but the referral from the friend, the referral from the community, those different layers that you can raise as you keep moving forward make a huge, huge difference in terms of building your reputation. They build your confidence and they build your team's confidence in you as well. Ultimately, I think that this is high stakes leadership anywhere that you are, whether it's the operating room, whether you're a teacher, whether you're a husband or a father or a mother, and you're working in your family, all of the stakes are high, right? All of the stakes are high. Whether you're an entrepreneur, whether you're mid-level management, whether you're working your way up from the bottom, whether you're a student, right? The stakes in life are high. The pressure is always going to be high. You have to have mechanisms that you can relieve pressure, and you have to have mechanisms that you can remain humble, remain confident, remain grateful, and will the good of the people that you're with. I think that is super, super important. I think we're going to try to hand it back to Nick here and see if anybody has questions or anything I can expand on.
Hello, Dr. Piefer, you hear me?
I can hear you great.
Perfect. Mike here from Dave's team. I think right now, Nick fell off a little bit. The connection right now in Zanzibar isn't the best, so I'm jumping here to help kind of facilitate and bring up some Q&A and some questions. We'll get rolling here. I'll be kicking this off. One, thank you again for an incredible insight there, about sharing the analogy between the boardroom versus obviously the surgical room itself. And my mind was racing through the vast many questions I had of kind of the comparison of the two. To kind of kick us off, to bring more people up who are messaging me and obviously have a variety of different questions to kind of to address what you were talking through there. My biggest thing that I'm so curious about is, what do you do internally to not displace any of that stress or anxiety that you're feeling internally? Because obviously your team in the operating room is feeding off your energy. What do you do? What are you telling yourself to not displace any of that stress or anxiety onto them? Because again, in the boardroom, that's such a common thing, especially for certain leaders or executives, to maybe feel that and displace that energy on other people. How are you able to control that in the highest of highest stakes?
So I think that, I mean, that's an excellent question. And the challenge in the operating room is, number one, you've got to recognize that those moments are going to come, right? The idea that everything is going to work perfectly every time, and that expectation that it's going to work out perfectly every time is 100% completely unrealistic. There are going to be challenges. And so as you keep moving forward, you're anticipating those challenges. You're anticipating not only with plan A, but plan B and plan C. How am I going to, what if as I pass this ACL graft, the ACL graft is not, it's too large for the tunnel? What do we do in this case? What happens when those scenarios are there? And those challenges happen, and they happen to everybody, but that happens with training and it happens with preparation. I think recognizing your own sort of tendencies, whether it's the tendency towards being the tyrant, or the tendency towards losing your cool, or understanding that tendency towards, avoiding the conflict, or not necessarily conflict, but avoiding the confrontation and the constructive criticism. If you're that person, You need to know that. And so for me, I always like to talk about is I'll talk about you looking at your hands. And so for you guys, it's not maybe as obvious, but when we're doing surgery and we're working with the arthroscope, which is the cameras that are inside of, say, a knee or a shoulder, right? The tendency is to look up at the screen, and the screen is like a small porthole on a ship, right? So it's a tiny circle. You're looking inside at anatomic landmarks, but it's not uncommon, especially for young surgeons, to look up and say, where the heck am I? I don't know what I'm looking at. And the tendency is to drive in closer, to look at the screen closer, to drive down into those problems, and you get further lost because you lose your perspective and you lose your orientation. The trick is to step back a little bit and look at your hands, because when you look down at your hands, you'll find not only can you see the orientation of the patient, how they're laying on the table, you can see the orientation of where your hands are, you can see your orientation of where the camera is pointing, and then well, if this camera is pointing forward, I should be looking at the biceps tendon, but look where my camera is pointing. And what we oftentimes find is as you reorient yourself in the operating room, you'll find out that you're looking in the wrong direction. The camera is not pointed where you thought it was. And that piece, I think, is the big challenge, and that reorientation, and then having that active plan for when things don't go the way that you were anticipating.
Amazing. I love that. Looking down at your hands. Thank you so much. And for those that are interested in asking questions, Dr. Jason Piefer, please message me directly. Happy to bring you up on stage. We'll get rolling here. I know we're on to our next Q&A here. Eric Meltzer, don't mind unmuting yourself, buddy, and going to ask Dr. Jason Piefer your question.
Cool. Thank you so much. So my question is, can you talk a little bit about how you create a sense of safety for your team? Because, like obviously you're doing rather risky things being an orthopedic surgeon, but for people that are business owners, and it's important to create a feeling of safety just to create like a secure, not safe a security net, but just talk about the importance of making your team feel safe and how you achieve that.
Absolutely. I think that's an amazing question, an amazing insight as well. So safety is of the utmost as we move forward in the operating room, but in business as well, right? If you operate from humility and from gratitude, and you move in a direction where your team feels empowered to help and they're founded on purpose, then that changes the way that they look, right? So in my example, so a nurse or a team member who's in the room who may see something that is that's dangerous, or may see something that's not going the way that they would anticipate. So imagine if, as the tyrant in the room, you've elevated the fear to such a level that now maybe an implant on the back table is not sterile, right? There's a piece of equipment that's not sterile, but as a nurse that if that unsterile implant has to go get reprocessed, it's going to take another 15 minutes. It's going to delay the surgery. The surgeon's already yelled at me 5 times during this case. He's making my life miserable. Well, if they're not empowered to step up and they don't feel that foundation of safety and respect to say, as long as we're doing what is willing the good of the patient, as long as we're doing what is best for my client, then I will always listen to what you have to say. Now, it doesn't mean that I will necessarily choose. Now, obviously, if you said, hey, this instrument is unsterile, then we're going to get a sterile instrument. We're not going to put a patient at risk. But I think that it's super important as we keep moving forward that you empower your team to know that they're an integral part of the team. If you're in the room with me, and you have a thought, then you can bring it up at any time, anywhere, and we will, and I'll consider what you have to say, right? If you feel like, as long as what you're trying to bring up, right? So oftentimes we have not only scrub nurses, we have anesthesia teams, we have physician assistants, we have nurse practitioners. You also have equipment reps, right? And so the equipment reps are oftentimes, they ultimately are making commissions off of what they're selling, right? Well, those guys know how to use their equipment. They know how to do what they need to do, but it becomes very clear in the operating room if they're trying to sell you something while you have somebody on the table. That's not a beneficial scenario for anybody. But if you can see and you can tell that what they're doing is willing the good of the patient, that it's doing what's best, hey, there may be a better option for this. That maybe it's not even their implant. Maybe they're going to ultimately not make the sale, but they're there to try to continue to help. Ultimately, that makes a huge difference. And so I think empowering people to understand that they have a purpose and that they have a place in your operating room as a leader, that's what gives them that safety. to be able to talk to you.
Well, thank you so much.
My pleasure. Thank you.
Perfect. Thank you, Eric. Appreciate it. Shantae, let's go to you next for your question. Thank you so much.
And happy New Year, Doc, to you and Mike and David's team. Feels
Thank you so
good to
much.
see someone else on stage that's in sports medicine as well. So I would love to know how you actually, I guess, maybe redirect whenever, maybe let's say, for instance, you have a protocol or a treatment plan that you're following and it's not working. And I noticed through my years in the industry that sometimes people can metastasize, like they'll get stuck in their head and they're not able to move on to, you know what I mean? Like to recreate or to redirect. Like, what is a strategy maybe that you use to kind of help get the team and everyone, back on their head back in the game to come up with another solution or to resolve it or to try something different or new? Because I know it goes across all businesses. That happens. Things just don't work.
Absolutely. Absolutely. I think that having not only having the confidence to move forward, but also that humility to say, does anybody else have an idea here that we can do? But I think having plan A, plan B, plan C, and never really being satisfied that you're as good as you can be, right? That you're as good as you can get as things keep moving forward. And so in the operating room, when things don't go the way that we anticipate, not only stepping back to reorient, but also continuing to move forward in a direction that we're always founded on willing the good of the patient. So that may mean that you need a new perspective. It may mean that you move to the other side of the table so that you can see a fracture a little bit better, or so that you can get the orientation of your reduction of this fracture a little bit better. It may mean that we need to go back in with a patient and re-engage in things like physical therapy, re-engage in things, or maybe we need to get more information. We're 6 months in and the knee's not moving the way it needs to. It can be very tempting as a surgeon to say, I know I did everything right. This is the patient's fault, right? And that ultimately serves no one. Right, the patient still is struggling to move. They're still challenged there, and they're still frustrated. And they're the ones who are living with the joint that maybe isn't moving the way they wanted it to, or the strength that they don't have yet. And so, giving them perspective and letting them know what you expect over the course of the time, whether it's 3 months, 6 months, 9 months, 12 months, but then also having the humility to say, hey, let's take another look. Let's get another X-ray. Let's get another MRI so that we can make sure that everything is where it should be, and move forward from there. I think that humility is super, super important in that scenario, and your team will feel that around you. If you are humble enough to say that you can be better, that you can always be better, then your team will be willing to work with you, and your clients will understand if things don't go the way they're supposed to, and that you want them in business. Your clients will understand as you continue to move forward, and they understand that you're willing their good, that you're doing what's best for them, that you're loving them not only as a client but as a business. I mean, then people will move forward and they will move mountains for you when you're united around that purpose. Thank you so much for the question.
Awesome. Thank you, Dr. Piefer. All right, I'm going to do a quick reset of the room here. If you guys want to ask a question, please raise your hand. I'll go ahead and bring you guys on stage as well. And we got a couple people jumping on now. Thank you guys so much. And then before we roll into it, Dr. Jason Piefer, can you go ahead and let us everybody know while we have other people joining the room here, where they can find you and contact you? And then we'll kind of do another reset here before we close out after we take a few more questions.
Sure, absolutely. So Jason, Jason, Piefer, P-I-E, F as in Frank, E-R, like apple pie for everybody, a little bit of Southern pie. Jason Piefer at gmail.com. That's my email address. You can email me if you want to get those leadership diagnostics. I can send those out to you. Just shoot me an email at jasonpiefer at gmail.com. I'm on Facebook as Jason Piefer. I'm on Instagram at Piefer Bone and Joint, PB&J. So at Piefer Bone and Joint. And you can also find me on LinkedIn as well. I'm happy to share any and all of this information when it comes to high stakes leadership. I am super passionate about trying to establish environments that allow and empower teams to do great things for people, for their patients, for their clients. That's another passion of mine, in addition to trying to help and serve patients to get them better. so that they can live lives and have livelihoods that they love.
Amazing. Thank you for sharing, Doctor. Appreciate it. All right, let's go into our next question here. Gigi, do you mind unmuting yourself and asking your question?
Hello, happy Friday, and thank you, Dr. Pfeiffer, for doing this. I really appreciate it. So, my question is, since what you're doing is high stakes, especially when you go into the operating room, and I hear a lot of doctors like there are a lot of things that you don't think, and I heard that some people like have faith in a higher power, and they say, when I go there, I just think about that because I can't anticipate everything. What role does that have in your day-to-day life, especially that you're doing on average 2 operating per day? So I'm wondering, do you have like a ritual or something like that before you go into the operating room?
Say that last part again.
If you have
Oh,
any
ritual. Yes, gotcha.
Yeah,
Yes.
anything like that before going in, like 'cause,
Sure.
you know.
So it brings me back to my high school football days. My high school football coach told us, faith is first, family is second, your school or your job is third, and football is last. Everything else comes after that. And so I think, Nick introduced me as a husband and a father. I think having faith and believing in a higher power for me is a very, very important aspect of my life. But I think taking a moment to center yourself, to be grateful for what you have, to be grateful for the opportunity, right? So sometimes I may go on call at 7 a.m. and not be finished from 7 a.m. Friday morning until 7 a.m. Monday. So I've got 3 full solid days of call plus time in the operating room, and to really refocus and be grateful for those opportunities, to be grateful for the gifts that you have. Whether that's skill in the operating room, whether it's skill as a negotiator, whether you're running a business, I think having that level of gratitude helps you to focus, and it helps to refocus the day, right? If you have big negotiations that are coming up, refocusing yourself so that you're focused on what needs to happen, I think is very, very important before you get moving. And then we always have a plan, right? You don't show up to a meeting without knowing what's happening. We even have, oftentimes when we're doing a shoulder replacement, we've mapped out the surgery before we've even started. When we're doing knee and hip replacements, we've planned and templated, and we know what sizes that we're anticipating to be using. We know where we're going to be, so the team is prepared and ready to go. And I think all of that becomes part of your preparation ritual, so that you can make your day and your activities move in a way that are always productive, that are always moving forward, and that are always willing the good of the patient.
Yeah, thank you so much for that. Appreciate it, and Happy New Year, everyone.
Thank you. Happy New Year.
Amazing. Thank you. All right. Happy New Year, everyone. We're going to go to someone who's always consistently here, who just came up on stage. Chima, do you mind jumping in here and asking a question? Not sure if you can hear me. The unmute's me in the lower right for you, buddy. If not, okay, we're going to go right to Easy Life. What do we got here for a question? You just jumped stage as well. Thank you so much.
Yeah, thank you very much, Mike, and thank you very much, Jason, for sharing that. This is Easy from London. I just want to know what your thoughts and your know-how is on if you want to drive a change and implement, new ideas and share your know-hows with your directors, and you have a lot of experience more than they do. How do you do that without them feeling threatened or feeling uncomfortable? Because, like myself, I've got a very strong personality, and when I come across very, that I know my onions. So I just want you to share your strategies and your know-how on how you can implement changes and drive change without letting your senior feel threatened or what's that word again? Uncomfortable.
Sure.
Thank
Sure.
you.
That's an excellent question. And so oftentimes we may be in a leadership position, or we may not be in that leadership position where we're working under somebody who may be even exhibiting some of these different things, where they're flustered or they're concerned or they're threatened. I think it is ultimately super important to understand that that we sleep in the bed we make for ourselves, right? We sleep in the bed we make. So if your leader, if the person that you're dealing with is threatened all the time, and they lead by fear, and they lead by raising their voice, using profanity, and that as a team member causes you to move faster, causes you to do more, you actually reinforcing bad behavior. And ultimately, even the best leaders, when they see, so for us in the operating room, we'll see that often, the surgeon who goes up to the front desk and starts beating their hand and yelling, and then people start moving really fast because they want to try to eliminate that painful feeling, right? They want to eliminate the confrontation, so they move faster. Well, ultimately, even the best of the best surgeons will look and say, well, if I want people to move faster, the only way that it works, it's not working by gratitude, it's working by fear. And now the entire team has established a scenario where they have to work and live in a constant state of fear, and that ultimately puts patients at risk because you don't get great outcomes when your team is not working together and is not founded on a common purpose. If you're in those scenarios, it takes courage, right? It takes courage, and it takes not only courage but conviction. You've got to be willing to know that if you step forward and you make a recommendation or you make something that ultimately you are doing for the good of your company, for the good of yourself, for the good of your leader, for the good of your clients, that the feeling of being threatened from a leader is really their feeling. That's their issue, and you can't control that. And so I think that I would encourage you that if you know that you're not threatening them, if your goal is not ultimately, I'm going to try to take this person's position, that's why I'm making this recommendation. If the foundation of your recommendations are solid and they're to will the good of your team, they're to ultimately have an amazing outcome for your client, then having the courage to step up and do that, even if it's uncomfortable, even if they feel threatened, even if you need to reinforce to them, all I want what's best for this team, and I want what's best for this patient, or I want what's best for this client. This has, I think that you can move forward in a way that is very, very safe and very comfortable once you can accept yourself that you can't control the feelings of your leader, and that what you're doing is ultimately for the best of your team and for the best of your client.
Thank you very much. Very well noted. Thank you.
Thank you so much for the question.
Perfect. We'll keep things rolling here. We got about 8 minutes left, so only got a couple questions here remaining. Again, if you want to squeeze your question in, raise your hand. We'll bring you up on stage. Next, let's go to Brent. What do you got, buddy?
Thank you, Mike. Really appreciate it. So, Jason, look, your message is amazing. I love all your values. Family first. It's really right in line with everything right on here with the Breakfast of Champions. So, loving it. But talking about business and leadership, right? So, I'm a family first guy. I own my business with my wife. We've got 6 kids. And we're very intentional about our time and our management and everything going on. For you, you mentioned you're so busy. You've got 600, procedures each year that your company does. 5,000 appointments. How did you get to that point, right? So our companies, we're marketing companies. We're constantly, trying to help businesses grow. Through leadership and all these, and the mindset and intention and all that stuff. How did you do it, right? How did you do it? Like right now, you're in a spot where you've excelled. So I think my question basically is, the spirit of you're already there and act with intention and provide all that value. What worked for you in establishing this great business that you have?
Well, I think that the beauty of that. So number one, anybody who tells you can get through without having to work, right? The easy way, and you've probably heard this a million times online or in social media, but there is no easy way, right? You're going to have to work. You're going to have to find those things. And I think there's a big trend now to talk about that there's no such thing as work-life balance. There's no such thing. And I think that that's not true. I think you can have a very beautiful balance in life. But what you need to cut out is you have to cut out the things that don't serve you and your family and your clients. And so, whether that's partying late at night, whether it's going out drinking, whether it's going and doing things that aren't serving you the way that they need to. That balance, that's the balance that people I think I hear about, especially when I talk with young people. I don't want to give up the fun parts of life, right? You've got to be able to find the fun in your family, find the fun in your 6 kids and your wife, right? My family is one of the most fun things that I have. Find the fun in those long days and those long hours that you're working, and the smiles from the patients that you work with, the smiles from your team. There's amazing pieces and there's amazing balance in your life without the things that can pull you down, without the things, whether it's, it can be substance abuse, it can be social media, it can be all different types of things that take away your time, that take you away from being productive and moving. And I think that imbalance, if you shift, you can be a great father and be a great mother and also be a great entrepreneur. You can be a great person and a great leader and a great boss and still be able to be healthy and still be able to enjoy a great life. All of those things are possible, and you don't have to be so imbalanced that, hey, I'm only going to do one thing, because ultimately you're going to burn out. And in medicine, burnout happens. You hear about it for doctors all the time. People who say, I've come to the end of my rope, right? And medicine became their driving force in their life. And it is super important. What we do is amazing. But if you don't find that level of balance, that release for yourself, then it can be a big, big challenge. Now, I will tell you that in the beginning, I worked hard. I took calls sometimes up to 15 nights a month. It was not easy to do the things that I needed to do to keep building my practice and building a reputation in the community. But you just have to keep showing up, and you have to continue to do the work. And then I think changing your perspective about that work to a perspective of gratitude and humility, it makes it much easier to tolerate longer hours and to tolerate those things as you move forward.
I love that. I'd like to stay connected with you. Do you mind dropping your information in the chat? I know Mike went over it, but that's really great. The decluttering and just having fun. Let's go. All right. Thank you so much. Really
Absolutely.
Appreciate you.
Will do.
Awesome. We've got a couple minutes here. We're closing out strong. I know, Marie, you want to ask a question, so you don't mind muting yourself and ask away.
Thanks. So kind of torn between what I want to ask because of time, but so maybe they kind of intertwined. Okay. When because we talked about values, right? And to me, I like the alignment with my values. It makes me, it helps me operate better. So when values and results are misaligned or they're in conflict, how do you lead in that situation? And then maybe a little slight part 2, I'll just throw it in, is like, and this could be the answer, right? When values and results are not aligned, maybe the answer, what was that the hardest leadership lesson you learned that a book didn't teach you or a mentor couldn't teach you? So I guess part 1 is the alignment part, and part 2 is what's the hardest leadership lesson you learned without a book or a mentor, something you did on your own. I know it's
Sure.
questions kind
Sure.
of sorry.
So I think the challenge with in terms of alignment with results, you have to set what your results are. What are your expectations? And ultimately, for me, the results are the good of my team and the good of the patient, right? And so if my results become profit driven, if my results are financial only, then that will be a complete misalignment of the ability to move forward. Because if you start treating patients and team members like tools, if you start treating people like numbers, whether they're clients or not, that becomes a major challenge as you move forward, and that will completely misalign what's happening. And so, and things happen, right? We do surgeries, and there are sometimes complications, and if you have treated somebody like a number and a paycheck, well, then that ultimately there's no way for you to will that person's good, and it costs you your reputation. It costs you the things that you need to be able to be successful in this business and really in any business. So I think from the beginning, you have to align your results with your purpose so that you can be where you need to be. I think the toughest lessons that I've had to learn, they came in a lot of what I talked about in that leadership diagnostic. All of those leadership diagnostics are things that I've felt pulled to do before, right? I've felt the feeling of that I may lose control in the operating room. I felt the feeling that that I want to avoid the conflict. Like, we could be better as a team, but this is going to take me an extra 15 minutes after a surgery at the end of a 12-hour day for us to go through and step through what we could do. And I think that ultimately the lesson that I learned is that you've got to be willing to look back at yourself and to be willing to constantly evaluate yourself to get better, right? And to not fool yourself. The temptation as a surgeon, the temptation as a CEO, the temptation as a high-level leader is to say, I don't really make mistakes, right? But the reality is everybody makes mistakes. Everybody can get better. And I think if you have that humility and grace to say to yourself, how could I be better? Ultimately, that will serve everyone. It will serve you. It'll serve your team. It'll serve everyone you work with to continuously get better over time. And I think that, I didn't see that. I don't know that I could say that I read that in a book anywhere. But humility and gratitude for what I've got. And then self-reflection, looking back and seeing where do I tend to have the biggest struggles? Am I a pleaser, right? Am I a person who gets flustered? Am I a person who I thought I was prepared, but I'm not prepared, right? All of those things are things that you can look in and look at yourself and see how you feel, and see how you rate as you keep moving forward.
Thank you so much. I could listen to you all day, and so thank you for being here with us.
Thank you so much. It's my pleasure.
Dr. Piefer, amazing job as always. Thank you so much. Obviously, we have even more people that want to contact you, reach out. I know you dropped some stuff in the chat there. Because I know a lot of people will be following up with you directly. Do you mind just saying out loud as well where people can find you, just in case they missed it in the chat, so they can be sure to reach out to you?
Yep, absolutely. So I'm on Facebook, Jason Piefer. That's P-I-E, like apple pie, F-E-R, like a southern fur. At Jason Piefer. Michelle Pfeiffer did me in long ago, so if you call me by, if you mispronounce it, I'll be fine. JasonPiefer@gmail.com. I'm at Pieferbone and Joint, or Pieferbone_joint on Instagram. And you can find me at Jason Piefer on LinkedIn. Please feel free to reach out to me at any time if you're interested in that leadership diagnostic. I've got that. And I'm looking forward to a bright future and to helping folks continue to lead in high stakes situations, to manage high pressure, and really to make a difference by loving the people that they work with and the people they work for.